Hello and welcome to NCTV episode 65, which is all about cervicogenic headaches and how to manage them. So to answer the number one question, what is a cervicogenic headache? It's simply another name for a headache that originates from the neck. It's one of the most common types of headache, and whilst they can happen at any age, they most often occur between the ages of 20 to 60. You may also hear them being referred to as secondary headaches because they originate from a primary underlying neck disorder, frequently with nerve irritation. Fortunately, by fixing your neck problem, you usually alleviate the headache. So why do they come about? Any dysfunction in the vertebral joints of the upper neck can limit movement and result in nerve irritation. By dysfunction, this could include not only compromise of the joints, but also ligaments, tendons, muscles, or even the discs between the vertebrae. People who experience cervicogenic headaches usually have a history of neck injury, such as whiplash, although it can just come about as a result of repetitive or sustained poor postures over time, and this will also damage these structures. Referred pain from the neck occurs because the nerves that supply the neck area also supply the skin overlying the head, jawline, backs of the eyes and the ears. Therefore, pain arising from the structures of the upper neck may refer pain via the nerves to any of these regions, thereby causing a cervicogenic headache. Other causes, aside from whiplash, may be heavy lifting, prolonged slouching, poor posture, excessive bending or twisting of the neck, working at a computer, or activities using the arms in front of the body like housework. The symptoms can include a gradual onset of neck pain and headache during an activity, a constant dull ache normally situated at the back of the head, although sometimes behind the eyes and temple region, and less commonly on the top of the head, forehead and ear region. Pain is usually felt on one side, but occasionally both sides of the head and face may be affected. Pain that's made worse by neck movement or posture. Neck pain itself, especially with tenderness on the upper neck joints. Stiffness and difficulty turning the neck. Pain, pins and needles or numbness may also be felt in the upper back, shoulders, arms or hands, although this is less common. Occasionally you may experience other symptoms including lightheadedness, dizziness, nausea, vomiting, tinnitus, which is a ringing in the ears, decreased concentration, an inability to function normally, and sometimes depression. In rare cases, cervicogenic headaches may also be associated with sensitivity to noise or light, blurred vision, and difficulty swallowing, making them easy to confuse with migraines or cluster headaches, although cervicogenic headache symptoms tend to be lower in severity. So now you know more about cervicogenic headaches and establish whether that's what you have, here's what you can do about it. Firstly, whilst this type of headache may respond to medications including analgesics, anti-inflammatories, stronger opioid-based medication, even nerve-blocking injections, these drugs usually treat the symptom of the headache and not the primary underlying cause. Unless the origin of the headache, i.e. the upper neck dysfunction, is treated and corrected, the headache will return in time. Physical therapy treatments will focus on the soft tissue release and joint restriction in the upper neck, as well as areas like the front of the neck, the upper back area as well. It may also involve some exercises to strengthen the weakened muscles or stretch the tightened muscles. Some of the modalities of treatments that have proven to be effective are manipulations of the neck and the upper back, myofascial release, trigger point therapy, posture correction, and acupuncture. Following physical therapy, recovery time varies depending on the compliance with treatment and the severity of injury. In minor cases of cervicogenic headaches, some people may be pain-free in as little as a few days, although sometimes it may take 2 to 3 weeks. In severe or chronic cases, a full recovery may take weeks to months. Remember to prevent headaches from returning and your neck relapsing into their bad habits. Continued management must include exercises involving a regular stretching program and specific strengthening exercises. Finally, correct the contributing factors, and this will go a long way towards preventing recurrence. The contributing factors may be inappropriate desk setup, poor carrying techniques or lifting techniques, inappropriate pillow or sleeping postures, a sedentary lifestyle, excessive slouching, bending forwards or shoulders going forwards, activities that involve that as well, stress management, and healthy diet and proper hydration. That just about concludes cervicogenic headaches, so I'll see you next time for some more bite-sized bits to help your health flourish. Bye for now.